example, interrupted or non-interrupted, make a layer of suture. After that, make one more layer, so the second layer, so the inner layer of suturing. After that, dissect the intestine space, and here you have anterior wall, and make the inner layer of the anterior wall and the superficial layer of the anterior wall. Understand? So, also when you make end to end, for example, you start making the anastamosis into the liver edge, yeah? Am I right?
Not understand. Yeah, free edge.
Free edge,
Yes, yes, yes.
So, there are no any mesentery. Also, this is also the mistake. When you make the anastamosis, so you need to remember the arcade structure of the mesentery artery. You dissect, make a dissection here, you make a dissection here. So, and when you remember, yeah, so the structure of the arcade, it goes here, here, and after that, here. And after that, here. This way. So, when you
So this is
Straight after this?
No, it's also an arc, one more arc, and one more arc. So it goes like this. Okay? Let us see. Arc and one more arc, and one more arc till the end. And here we have the straight way direction.
Arteries.
Yeah. So when you dissect it, so you dissect the intestine this way or this way. So the direction never will be totally straight, because you damage the artery and you need to save it. So, and the anastomosis between them will be yeah, little
So
oblique.
this one we cut like this, and
You need to think about it.
this also like this, and like this, right?
Maybe. So you need to remember about all the features of the anastomosis. It's quite possible. It's quite possible. So you start making the anastomosis. You have the hold suture here and hold suture here. This is the posterior wall of the anastomosis. You start making the lower layer of the suturing, and after that, the lower, and after that, so the superficial layer, and after that inner layer. And here you make it vice versa. You start making the inner layer, and after that superficial layer.